working families where at least one of the parents is working more than one job. That was the case in my family growing up. We were a large bunch. My parents had 7 kids, and both of my parents worked outside of the home when we were growing up. And my dad had 2 jobs. My mom cleaned homes, and my dad worked 2 jobs. So we rarely saw him except for on his day off. And he was usually in bed trying to get rest and renewal. But as we think about blessing our children, just as Jesus blessed our children, I think it's imperative for us to look at not just why our children are homeless, but what is causing it. We know that today, especially because of the pandemic, that there are more working families that have already lost their housing or they are on the verge of it. I lived in Washington, D.C. for 14 years. Affordable housing was something that was rare. It's also the same in the Denver, Colorado area where Bishop Olivetti and I reside. And so, if we are going to have healthy communities, then we have to have healthy children. As I look around the communities where our ministry takes place in Salt Lake City and Magna and West Jordan, the Denver, Colorado area, Idaho, and Wyoming, as well as northern New Mexico, our indigenous families are dying from COVID more than any other population in our country. And then we next are our brown and black communities. And what are our children going to do if our parents are not, if their parents are no longer there? So I ask myself over and over again if we are going to seek the welfare of our children, we must seek the welfare of families. In Jeremiah 29, chapters 1 through 14, Jeremiah is writing a letter to the exiles who have been taken from Jerusalem into um, Babylon. And one of the things he's writing to them, he's telling them that I want you to build houses and that you are to do the things that you would normally do in your families if you were here in Jerusalem. But the one thing that he said that really speaks to me and me reshaping my ministry, he says, but seek the welfare of the city where I have sent you into exile and pray to the Lord on its behalf, for in its welfare you find your own welfare. And so today I understand our ministry as people of faith is in seeking the welfare of the people that are in the cities where we live, where we work, in the state of Utah, in the state of Colorado, wherever it is that we are called as people of faith to create healthy communities. And that starts with our children. Thank you so much for the opportunity to share with you. And unfortunately, like Bishop Olivetti, I have to run off to another meeting, but I am grateful for this time. Thank you, Bill, so much for having me.
Thank you so much for making time for us.
I do have a question. Will this be made available to share?
It will.
Thank you so much. God's blessings.
We don't hear you, Bishop Oliveto. Are you ready to go?
I didn't know. Yes, I didn't know if there was going to be an introduction, so I'm good to go. Good morning. It's great to gather with you to discuss and address reducing homelessness in the great state of Utah, and to especially address the homelessness of children. I bring you greetings from United Methodist congregations and members across the state of Utah. Gandhi once said, "The true measure of any society can be found in how it treats its most vulnerable members." If we were to measure ourselves right now, as we see statistics of homelessness on the rise across our country and state, especially the economic crisis so many individuals and families are experiencing due to COVID, we would have to admit we are far from the ideals we hold for our common life. I'm going to share a little personal background and why this is such an important topic for me. Before becoming the United Methodist Bishop of this region, I was the lead pastor of the 12,000 member church in San Francisco Glide Memorial. In the midst of one of San Francisco's poorest communities, where poverty lined the faces of people who live there, we had at the church 87 ministry programs to address the needs of those who were overlooked, those who were pushed to the margins of society. The center of our work was with those who were homeless or were formerly homeless, from offering 3 free meals a day, 364 days a year, recovery programs, harm reduction program, health care, educational opportunities, legal assistance, housing, and workforce development. Anytime a need was presented to us, we had an imperative to respond. And so we worked with those in need in order to help every person, no matter who they were, to thrive. Our work was made possible because we partnered with city, state, and federal government to bring healing and opportunities to people in need. Even in such a supportive environment, the shame and toll homelessness was carried was like a heavy weight. So a major focus was simply loving people, helping them understand that they were worthy of love, worthy of help, worthy of a different life than what they were experiencing. There was one teenager, Drew, who came to church every Sunday. He would sit on the steps leading up to the altar every single Sunday. He always wore the same tie and crumpled button-down shirt and sat right up there with his Bible. I had this whole image of his life outside of church, that he would get home, he would rip off his shirt and tie and throw it in a corner of his bedroom until the following Sunday when he'd put it back on. After several weeks, we learned that Drew was homeless. There was no bedroom. There was no bed for Drew. 15 years old. That tie and button-down shirt was removed after church and stuffed deep down into his knapsack that possessed the only things he owned, and was removed the following Sunday. The people who were supposed to nurture and protect him couldn't or wouldn't. So the streets were safer for him than his home. To be a young person who has no home is to live a nightmare. They have to do terrible things to survive the streets, to find food and shelter, and unspeakable things are done to them. I give thanks to the Glide community who wrapped love around Drew like the warmest and most loved family heirloom quilt. They homeschooled him. They made sure he had enough food to eat. They found him housing and provided him with a structure so he could feel safe enough to heal from the horrors and the trauma he suffered. Every religious tradition teaches about caring for the needy. This unites us across our different theological lines. In my tradition, Matthew 25, the gospel highlights this. For I was hungry and you gave me food. I was thirsty and you gave me something to drink. I was a stranger and you welcomed me. I was naked and you gave me clothing. I was sick and you took care of me. I was in prison and you visited me. Then the righteous will answer, Lord, when did we see you hungry and give you food, or thirsty and give you something to drink? And when was it that we saw you a stranger and welcomed you, or naked and gave you clothing? And when were you sick or in prison, and when did we visit you? And the king will answer them, truly I tell you, just as you did it to the least of these who are members of my family, you did it to me. This is the ethical imperative that drives me. And each religious tradition similarly is called to center the needs of the poor and respond in compassion and love. Every family that remains homeless, every child that doesn't have a bed to call their own, creates not only trauma in these families and children, but society suffers. Without the stability of a home, of supportive services to those who are at risk, we all lose out on the gifts that these ones could contribute that will make us all a better people. When faith communities partner with government agencies, we can do great things. We can change lives. We can heal the broken places of our common life. We can build beloved community together. Thank you.
Thank you so much, Bishop Oliveto, and I know you're busy, so we will hopefully see you some other time soon. I'm really excited about our, thank you. I'm really excited about our other speakers who we have coming up. We have Crossroads Urban Center produced a report in September of last year where we looked at child homelessness, and we found that there were 14,002 people from families with children who had been homeless in the state of Utah or had received homeless services in the state of Utah during the years 2017 through 2019. Over half of those families had been homeless, were out of the shelter in less than a month, in a month or less. And so there are a lot of families who become homeless where it's a short-term economic crisis. If there were more affordable housing, they would either not become homeless or be homeless for a shorter time. And so we invited Sarah Brundage from the enterprise community. Well, I guess I'm nervous because I'm forgetting words, but from Enterprise Community Partners to talk about some exciting enhancements to federal housing credits that make state investments go further. And then we've asked Senator Derek Kitchen to talk about how affordable housing is infrastructure that helps our whole state, and the prospects for increasing funding for affordable housing. This session, I will turn the time over to Ms. Brundage.
Thank you. I'm very happy to be here with you all virtually. It's hard to follow such inspirational and kind of grounding perspectives, and good reminder of all like the human stories and why we're all doing this work in whatever form we're doing it. So as Bill said, my name's Sarah Brundage. I'm the Senior Policy Director with Enterprise Community Partners. And I'm going to speak about the low-income housing tax credit in particular and get into some policy updates as well as some policy advocacy, I guess, perspective about what to expect next year and how your advocacy will continue to be really important in 2021 with the new administration, this next Congress. So just as a little background, Enterprise, we co-chair the National Action Campaign along with the National Council of State Housing Agencies. So Utah has a state housing finance agency that administers low-income housing tax credit. The Action Campaign is a coalition of nearly 2,400 organizational members, including many in Utah. And it's a coalition committed to addressing the nation's severe shortage of affordable rental housing by strengthening and expanding the low-income housing tax credit. If your organization, and we welcome faith-based organizations, absolutely, are not yet members, you can join for free, because the coalition, our power is definitely in our numbers. And when we do meetings with members of Congress in the Utah delegation, we bring which organizations in Utah have joined our coalition. So just putting that little plug in, and our website is rentalhousingaction.org, where you can learn a lot more about our advocacy work. The low-income housing tax credit is our nation's largest program for preserving and producing new affordable housing. It finances virtually all affordable housing development, including permanently supportive housing, which serves households and individuals who formerly experienced homelessness. In Utah, specifically, I looked it up, since the program's inception, the housing credit has financed nearly 29,000 affordable homes in the state, serving an estimated 69,500 low-income households. So this program is really critical for us having enough affordable housing for people who have experienced homelessness to have support and the long-term stability that we know an affordable, safe, and healthy home provides. So our coalition's signature legislation is called the Affordable Housing Credit Improvement Act. It's a bipartisan, bicameral bill that would expand and strengthen the housing credit. It has many provisions in it, and in some, we estimate that it could provide an additional 610,000 additional affordable homes nationwide over the next 10 years. One of its original co-sponsors was the former Senator Orrin Hatch. He retired. We now have bipartisan champions in the Senate. It's Senator Maria Cantwell from Washington, Senator Young from Indiana, Ron Wyden from Oregon, and Johnny Isakson from Georgia, who's retired. So we'll be looking for new champions as well. And we also have a identical bill on the House side with bipartisan champions. What I really want to get into, though, is kind of what has happened this year. What are some big wins that are going to help you all at the state level? And again, what we can expect looking forward. So over the course of the 116th Congress, the Affordable Housing Credit Improvement Act gained overwhelming support, and actually right before everything in Washington shut down because of the coronavirus, we had actually just passed a milestone of having more than half of the House co-sponsor the bill. So it was the most popular bipartisan affordable housing bill this last session. It had tremendous support. But then with the COVID-19 crisis, the Action Campaign and all housing advocates really had to pivot our attention to addressing the crisis at hand. You know, with COVID, you know, we saw, we already know that nearly 11 million households spend more than half of their income on rent alone. And with the economic downturn, we just knew that renters were going to be even more impacted in terms of housing cost burdens. And with the need for affordable housing being greater than ever, you know, the housing credit was also more important than ever in terms of continuing to both stabilize and protect, but grow our pipeline of having enough affordable housing communities, as more households will be continuing to need economic recovery. The COVID-19 crisis also brought some new barriers and challenges for the housing credit for a variety of reasons, including there were construction moratoriums and just additional costs with medical safety measures. But most importantly, it devalued the 4% housing credit rate. So the housing credit has two sides of it. I'll try to really simplify this, but the 4% side of the housing credit program, the value of that credit actually fluctuates tied to federal borrowing rates. This is unlike most tax credits. And so in response to the economic downturn, federal borrowing rates were slashed. And so the value of this 4% housing credit rate was far below 4%. It's really just been called that, but it reached a historic low in August, I think, of 3.07%. Long story short, this put into jeopardy the financial feasibility of many affordable housing developments that were already in the pipeline, and it really just undermined the value of this credit in terms of being able to preserve and build new affordable housing. And so one of our big asks, and this was included in our signature bill, but it became more urgent than ever and directly tied to the coronavirus crisis, was to finally permanently establish a minimum 4% housing credit rate, to have it really match its name. And this would provide developers with more predictability, greater value in terms of the equity they receive, and just help make these developments pencil out. And so we advocated for that, as well as regulatory changes to make the program work better, despite delays in meeting some of those programmatic deadlines. And at the end of the year, as folks may know, Congress passed this huge package. It was a $1.4 trillion omnibus appropriations package. It included $900 billion in COVID-19 relief. There are other housing-related items in there, such as emergency rental housing assistance, a very short-term extension of the eviction moratorium. But we were thrilled as the Action Campaign to finally have secured a permanent minimum 4% housing credit rate. So this will be effective for properties moving forward. Another thing that I wanted to call out that especially will help Utah is the package also included a new round of disaster relief housing credits. So these housing credits are available for states and territories that qualified through FEMA and had major natural disasters that occurred within a certain time period in 2019 to 2020, I believe. And Utah is one of the states. And I think I looked it up, Novogradac estimates that Utah will receive $5.3 million in 2021 disaster authority, and this will go to qualifying counties. I think the states will have the authority to determine how they spend those housing credit dollars, but this is an increase. I think the disaster housing credits that Utah is going to receive are 58.8% of the state ceiling. So this is a big surge in housing credits to help rebuild in disaster-stricken counties in Utah. So that's something else to look forward. And this will help, the housing credit pairs with state and local funding for housing. So it's a great way to leverage, help all these dollars go further and build more affordable homes. Just to kind of wrap things up quickly about looking forward, they'll ask that I touch on quickly housing as infrastructure. This has been something that housing advocates have been talking about a long time. We expect, an infrastructure package was a priority of the current administration. It's going to be a priority with the next administration, something Congress has been working on a long time, and we've all been, for a long time, trying to help make the case that housing infrastructure is part of it. It's not just roads and highways. And I think we've been really successful, and that's another kind of advocacy point we can continue to use state and local help with. But in July, the House passed an infrastructure package called the Moving Forward Act. It was a huge package that outlined what was essentially House Democrats' priorities for an infrastructure package. It had a massive section for the housing credit, which we were thrilled about. That had many provisions to strengthen and expand it. And the Senate Finance Committee, the Democrats on the Senate Finance Committee introduced an identical bill to the housing credit section. And with Democrats having the margin thin majority in the Senate, and the ranking member of the Senate Finance Committee, Ron Wyden, will become presumably the committee chair. This positions the housing credit really well to be included in any infrastructure package that this next Congress advances. So that's something we'll continue to be advocating for. And I think you'll certainly hear calls to action from the Action Campaign and other folks in DC to make sure that these housing credit provisions are included. And I'll just wrap by saying, we're all gearing up to work with the next administration. The Biden-Harris administration did release a housing plan in early 2020 that called for $10 billion in investments from the housing credit program, and just wanting to ensure that the housing credit can serve urban, rural, and suburban communities. So the Action Campaign will, looks forward to working with the Biden-Harris administration. I'll also note that in terms of the HUD Secretary, Representative Marcia Fudge, who's Democratic representative from Ohio's 11th District, has been nominated to be the HUD Secretary. She has, in her role as the representative, co-sponsored the Affordable Housing Credit Improvement Act. And then Janet Yellen was nominated to serve as Treasury Secretary, and the Treasury is technically the agency that oversees the housing credit since it's a tax provision. So those will both be two really critical leaders in the next administration that advocates will be engaging with for federal affordable housing policy moving forward. So I think that's it for me, but Bill, are we doing questions now or at the end, or because we all have so many engagements?
I think what I will do is I will field questions. If people have questions for you, they can send them to me, and which I will talk about at the end, and I will share them with you.
Yes, I'm happy to answer any questions, and that was a lot of information, so feel free to send any follow-ups, and just thank you for having me. And I just want to thank everyone on this call who I can't see for the work that you all are doing. And we're all looking forward to hopefully a better year. I'll just put it that way.
I thank you so much. It's really helpful for us. I know you got to go, but it's really helpful for us to hear about improvements to housing policy at the national level. I think every affordable housing project in Utah that I can think about has included one of the federal low-income housing tax credits, and so it's part of the financing. And so hearing that there are improvements mean that efforts to increase state funding could potentially have a bigger impact. And so we're pleased that Senator Derek Kitchen from the Utah State Senate has agreed to come talk about why he believes housing is infrastructure and why it's important that the legislature invest more in affordable housing during this 45-day session that begins on Tuesday. Thank you.
Is that a handoff to me, Bill? Okay, great. Well, good morning, everybody. And I just want to first offer my gratitude and appreciation for this conversation. I appreciate, of course, Crossroads, Bill, and everybody on your team, and of course, the Coalition of Religious Communities for pulling this important conversation together. I'm really happy to be here today. As I was preparing for this, I immediately went to the most recent report from the Kempsey Gardner Institute, just to refresh my memory on some of the important data points that they've highlighted. And one thing that stood out and I kept thinking about on repeat over the last couple of days is this important statistic that over the last 11 years, Utah households have increased by about 220,000 households. We're a growing community. We all see it every day. But in that same time, we've only seen about 185,000 unit increase in housing. And so that leaves us with about a 35,000 or so deficit when it comes to dwelling units in the state of Utah. And that's a huge problem right on its face. Despite record apartment construction, explosive growth in single family and mid-sized development of dwellings, we're just not keeping up with our population growth. And I think that's part of the reason why you see a 5 to 7% increase in rental rates by and large across the Wasatch Front. And I think that that's really informative as we think about the development and construction of affordable, either naturally occurring affordable or subsidized and deeply affordable housing units in Utah. And so, thinking about housing in terms of critical infrastructure is something that we really have to focus on, starting today and in perpetuity. And so just in that vein, I want to think about the housing affordability crisis as it maps out and project forward into, with our population growth, how we can begin to sort of get our arms around these major issues. And I think about it in terms of economics as well, because it can, the deficit of affordable housing can create real problems long-term for our economic health. When people can't afford housing, it impacts not only our quality of life and our workforce. Hi, Senator Escamilla, I see you there. Welcome, good to see you. But the lack of affordable housing also impacts our opportunities for economic growth. Having affordable housing is a critical component of diverse and stable economic health in the state of Utah. And so I think about last year and how much the Utah Legislature was able to focus on affordable housing through Senator Andrade and a number of other key legislators. Unfortunately, due to the pandemic, a lot of that housing funding was pulled away back in May. And so getting the funding restored entirely to pre-pandemic levels is key for us going forward. And in fact, I would argue that we need to increase the funding that was proposed in the original draft. When that bill was originally drafted, we as state officials estimated that $15 million in state funding would leverage around $238 million in private sector match. And so in terms of bonding. And so I think about the impact to the low-income housing tax credits, the LIHTC, and all of those additional funding tools that we have, what this additional dollars could have meant for those who are experiencing homelessness or are on the verge of slipping into homelessness in our community. And the fact that that simple investment in cash, in hard cash, would have resulted in direct over 2,000 individual rental units in our community for people who are experiencing homelessness. And I think back to the report that Bill highlighted from last September, where you highlighted families and children who receive homeless services in 2019. And I think about the average family at a shelter had just over 3 people in it. And so if we're going to build 2,300 units with $15 million, that would have provided an enormous safety net for these families that are experiencing homelessness and that are drawing on our critical services and really living in the rough. And in Utah, I think it's important to note as well that 1 in 3 adults are behind on rent or mortgage payments. And 1 in 3 of these adults believe that they will be foreclosed on or evicted in the next 2 to 3 months. Let that sink in for a minute. 1 in 3 adults in Utah believe that they're going to be evicted or served foreclosure in the next 1 to 3 months. That's huge. The need to invest in affordable housing could not be more clear. It's obvious that we need to put our money where our mouth is. We've got to put hard cash into the development of affordable housing in Utah. Unfortunately, Governor Cox has released his budget for the next fiscal year. Unfortunately, it does not restore that funding for affordable housing that was stripped out in May. And of course, it doesn't include new housing funding, which we need. It does, however, propose using over $30 million in cash for the development and construction of things like liquor stores versus our typical practice of bonding for these types of facilities. So I think that maybe there's an opportunity for the legislature to shift some of our priorities a little bit, because it's clear we have money. The state of Utah has cash to spend. It's a matter of priorities. In fact, you may have heard in the news recently, some of my Republican colleagues are focused on bringing an $80 million or so tax break to families and businesses this year. I would argue, based on feedback that I hear from thousands of constituents and people all along the Wasatch Front, it's not the tax break we need. We need services and we need housing. This money, this $80 million, should not be used for a tax break. It should be used to fund affordable housing in our community. We really need to be bold. We need to be imaginative, and we need to look at what we have in front of us. We have the cash. It's a matter of priorities. The pandemic itself has created serious concerns for how people will continue to pay their rent and mortgages, and it's important that we as leaders step up with solutions. I think about the election results from last week in Georgia, and Sarah touched on that a little bit, in the fact that we have, the Democrats, I should say, have a slim majority in the Senate. And I do believe that this presents a huge opportunity for us to move forward with a new relief package to address issues relating to COVID, but also look forward and finally, as a country, begin to address the issues of infrastructure. As Sarah mentioned before me, we frequently think of infrastructure in terms of highways and train and rail lines and airline issues and runways and things like that. But I also I think we got to be realistic here, that without housing, without stable affordable housing for Utahns and Americans, we're going to come up short. And so I believe that new federal money from our new Congress and our new president presents an opportunity for us as a state to be ready with shovel-ready projects for housing and a clear vision for what we want to do with our infrastructure dollars. So I see, with federal dollars coming, as well as an opportunity to be creative in our state budget, we can really make an impact in the lives of those who are most vulnerable. And so I think I'll maybe leave it there. I have some time, so I'll stick around for a Q&A if it does exist. And I just want to thank you once again for including me in this really important conversation. And I'll stick around. So thank you so much.
Thank you so much, Senator Kitchen, for taking time to talk with us and for talking. I mean, I agree with everything you said, and I'm grateful that you were willing to share with us. I think actually, in terms of the new Congress, it's the odds that the state will be, that some sort of fiscal relief will be passed through Congress before the end of our state legislative session are now much higher. And so if there are any excuses for not investing in housing now, there will be less if new federal funding comes to the state before the end of the session. I think it's with our next topic that we want to talk about, because our goal is to talk about really specific ways that the legislature this session can reduce child homelessness or families with homelessness for families with children. And one approach that we identified in a report is to try to use Medicaid funding to increase outreach to families that have been homeless. In our report, we found that every year there are families that become homeless for the fourth, the fifth more times in a 3-year period. And so we know that health conditions can contribute to a family becoming homeless. And we know that the trauma of being homeless actually increases the incidence of some fairly specific health conditions. And so it makes sense to look at what other states are doing in terms of providing, using Medicaid funding to expand outreach to people who've experienced homelessness. And we're really grateful that Jennifer Sullivan, who's the Deputy Director of Housing and Health Integration at the Center on Budget and Policy Priorities in Washington, D.C. We'd like to thank her for coming and sharing. She has a PowerPoint presentation, and so I will shut up and let her present that.
Good afternoon, or good morning, I guess, for those of you in Utah. Thanks so much, Bill and the Crossroads Urban Center, for inviting me to join you in this important dialogue this morning. I'm going to attempt to pull up my presentation. Oh, you know what, Bill, it says that I can't do screen sharing. So why don't I'll just not have slides. How about that? So my role at the Center on Budget and Policy Priorities, which is a Washington, D.C. based research and policy institute, is to, I sit on both of our health and our housing teams, and the project I lead, the Connecting the Dots project, is aimed at better integrating these two critical systems to improve health outcomes, particularly for people with complex needs. So that includes people with significant barriers to housing and to health coverage. People experiencing homelessness certainly are at the top of that list, or housing instability. As well as people with behavioral health conditions, people with disabilities, and people re-entering from the criminal legal system. Now, I was delighted to come here and talk a little bit today because health and housing are increasingly being talked about in the same rooms, which is a really exciting thing for people who are working on these issues. The research is with us. I think even my first grade son, who's sitting upstairs, doing homeschool right now, could tell you, or remote school, well, of course, housing and health are related. This is not rocket science, but fortunately, we also have a robust body of research that bears out the many ways that these connections are critical. Housing can reduce over-institutionalization by helping people live in the community as opposed to in congregate settings and nursing homes. It can reduce the overuse of crisis care services, which are costly to provide and not something anyone wants to have to need. If you're stably housed and you can avoid that experience, that's a good thing for your well-being. It can stabilize chronic conditions due to homelessness. Housing can correct unsafe or unhealthy housing for neighborhood, unhealthy or unsafe conditions in a neighborhood. It can also help people move to neighborhoods where there's more opportunities and they can thrive. The connections between stable housing and improved mental health are strong. And right now we know that as we're living amidst, month 10 or 11 of a global pandemic, housing can reduce the risk of contracting communicable diseases that can sometimes lead to death. Recent research that just came out in late November, early December, pointed to an increase in incidence of COVID as well as deaths due to COVID-19 in states that failed to extend eviction moratoriums. There's an intrinsic link between housing stability and health outcomes. So whenever I have these conversations, I always like to just really quickly run through some terms that get thrown around. When we're doing cross-system work, it's really important that we ground ourselves in the same language because we all speak slightly different language and we don't have time to talk past each other. So when we talk about social determinants of health, that is becoming or has become in recent years a real buzzword. I just want to call out that when we're talking about connecting people to health coverage, connecting people to housing, connecting people to other services they need, we're meeting social needs, and that's critically important, and most of these services are woefully underfunded. We aren't addressing the upstream factors that lead to certain people having greater needs for these services, certain people being underserved, and certain zip codes having lower life expectancies than others. Those systemic issues that come from our tax code, that come from wealth distribution, that come from systemic and institutional racism are also critical, and we can't solve all the problems with single solutions. So I just want to point out that one of the ways to improve health and housing is really to look further upstream at these the true sort of root causes of outcomes. So what I really am here today to talk about, and I feel like I'm already going to be over time, is what can Medicaid do? What is Medicaid's role in all of this? Important policy fact, Medicaid cannot cover room and board. It is statutorily prohibited from paying anyone's rent. It's not the purpose of Medicaid. The purpose of Medicaid is to provide healthcare services, the things we typically think about people receiving in the doctor's office, in the hospital. However, and I'll say that that's not waivable. There are lots of opportunities to experiment, to use Medicaid flexibilities to improve outcomes and tailor them in particular states and for particular communities. But the prohibition on paying for room and board is not waivable. But fortunately, there are lots of ways that Medicaid can support sort of addressing social needs and connecting people to coverage. Medicaid can really grease the wheels and help existing enrollees better connect to the services and supports that do exist in the community. And I think the one that is of most importance in this conversation is a waiver pathway. It's called an 1115 waiver. I've got policy wonks listening. And this is an opportunity. I think North Carolina is a state that I would lift up just for today's conversation, but lots and lots of states have Medicaid waivers for lots and lots of different kinds of things. An 1115 waiver in the social determinants context can help connect people to critical social services in the housing space. That's pre-tenancy and tenancy support services. Things like doing a housing search, preparing for a move, understanding your rights and responsibilities as a tenant. Medicaid can pay for some of those services for states that request the authority. And there are other pathways, many of them, the ones that are best tested are for delivering these services to people with significant complex healthcare needs. That being said, I know today's conversation certainly is centered around children and the increasing incidence, particularly of homelessness and housing instability among children in Utah. North Carolina, I mentioned, is the model that I would lift up because they had a relatively recently approved authority to use Medicaid to connect certain children to pre-tenancy and tenancy support services. Now, you have to meet both, you have to meet two criteria. You can't just be a child enrolled in Medicaid. You must have a needs-based criteria. So you have 3 or more adverse childhood experiences, you're enrolled in the foster care system, you have significant unmanaged chronic needs. So those are your needs-based criteria. And then you also have to meet social risk factors. And one of them certainly for this would be housing instability. Now that's one model. It is something that for the next week, the current administration has approved. The next administration will take their own interpretation of these things. And so we have yet to see exactly what direction and what level of permissibility they will take with some of these kinds of waivers. But it is one pathway, and it is a place where states are encouraged to really explore the ways that they can tailor the program to better meet the needs in their state. Now, the last thing that I will say is to sort of build on what the senator has already shared, is we're at a unique moment. We've got these converging health and economic crises. Our research has found that nationally, 12.4 million renters as of November, and this number has only grown, are not caught up on their rent. This is worse for kids. 4 in 10 kids who live in rental housing are in families that are behind on rent or not getting enough food, or both. Things are bad right now, and one of the reasons that things are so bad in the housing space is because we only provide federal housing support for a quarter of the people who qualify. In Medicaid, we can cover anybody who comes through the door and is eligible. However, that's not the case in housing. There are rental assistance vouchers, and you can qualify, and you may not get one if there's not one available where you live. And so this is a problem that can also be solved. Policy can solve these problems. Policy created these problems, and therefore it can also solve them. But what Medicaid can do is limited by what's on the other side of the bridge that it can build. It can connect people to other programs, but if there's nothing on the other side, and if these programs continue to be underfunded, Medicaid can only do so much. So it's also critical, and I would just close by saying this, that whoever is at this table, we often are having this conversation with healthcare stakeholders, but anybody at this table who cares about these issues needs to think long and hard, not only about what the healthcare system can do, but what is necessary to increase investment in federal housing assistance. That's just a critical piece of the puzzle. So I'm happy to talk with folks, answer any questions whenever the appropriate time is. And thanks again so much for having me today.
Well, thank you so much for presenting that. I think we often, at the state level, it's really, really helpful to know that something is possible, right? I mean, and so because another state is doing it. And so I would like to turn the time over to our final speaker today, Senator Luz Escamilla, who actually was a health policy advocate before she became an elected official. And so I am one of the people who actually got to work with her in that role, and I'm still delighted that she is in the state Senate. So I should say, I mean, in terms of using Medicaid to provide better services to families with children that have been homeless, we've been talking to the House sponsor of the big homeless governance bill that is being talked about, and have had some interest in possibly including language authorizing Utah to move this way in that bill. Hopefully, part of our plan for this session is to encourage that to happen. So I'll turn the time over to, and I should say, we will, if it's okay with Ms. Sullivan, we will share the PowerPoint with the people who attended, and just because I apparently screwed up in the settings for this to make it so we couldn't share it during the event. So with that, I'll turn the time over to Senator Escamilla.
Thank you, Bill, and it's always a pleasure to work with you, and definitely many years in the making. We won't say how many. We were teenagers when it started, so we'll leave it at that. I think I really appreciate the framework of this of today's mini conference or presentations. The fact that we put some a human component and the reality of that was given by the pastor and the previous presenters. Thank you. That was very enlightening, and we cannot lose perspective on why we're here and how this is about people. It's about children, it's about families, and how critical those pieces are as we continue our work and the conversations to find solutions. I'm a true believer in integrated solutions, and I think in the case of addressing the housing instability for families and children specifically, you can't think about this in an isolated environment. It really is about a holistic approach to finding solutions. And I certainly the pandemic, many of us here are obviously, I'm preaching to the choir. We knew about social determinants of health. We've been talking about them for decades, and seeing the pandemic brought it to a light and to just a reality that was hitting in the face of everyone. Talking about how it disproportionately was impacting communities of color and specific zip codes. When you think about those hotspots in our state, certainly my district took all the hotspots initially, and it's continued to be huge hotspots. And you look at those demographics and those children that are living in those districts, and we knew this coming into the pandemic. So what happens moving forward is that certainly the time is right to have the conversations, and there will be some big ticket items in terms of funding, and we need to talk. And like Senator Kitchen said, we have to invest in families and children and people and the human capital that the state of Utah continues to be so proud of being the best managed state. I think we want to be also the state that invests in people the best way. And we're certainly not there yet, and we're going to work towards that. So what do we do moving forward? As Bill said, in my previous life, I used to do advocacy work hand in hand with Crossroads and Voices for Utah Children and other organizations. I used to work for an awesome organization that was named Utah Issues. And it really brought a lot of amazing people that have done this work for years. And we kind of like became experts on incrementalism. I think this year is about talking the huge reform. And I have two bills. One that's a very unique bill, and I think can address some of the Medicaid components that Ms. Sullivan presented a minute ago. And that is a children health coverage initiative. I think it's the time where we cover every child in our state. No kid in our state, though, especially after this pandemic, should be without adequate health coverage. So you're going to see a very big initiative moving forward. I know it's a big ticket item, but the time is right to invest in our kids. And I think we need to be talking about this integrated approach about housing. So housing stability, food security, and of course, health coverage as a component of someone's livelihood and the ability to have a quality of life. So I'm also running legislation addressing food security, having a true plan and a blueprint for food security. We don't have it. Most states have it. I'm working with Youth Against Hunger that have done multiple research work on this, and we're prepared for that. So you'll see also one of my bills addressing a food security plan and integrating this again with the Medicaid component, the healthcare component for children. And I think the time is right to make sure that we focus on solutions where we can see that return on investment. And when we talk funding, and as a person that negotiates a lot of the budget for the Senate Democrats and with the different caucuses in the state legislature, it's going to be a tough year. And I say this because there is some one-time funding, right? We're talking about $400 million that we definitely want to invest on infrastructure, and housing could be a great place to invest some of those millions of dollars. So just know that I think there's multiple people, including myself, that we're advocating to use those funds, that we are considering a one-time fiscal impact for housing. I mean, this is a time, because it is a one-time funding that could provide us with some infrastructure. I also just want to mention that we don't want to miss the opportunity to highlight things that are working, right? We have in the state of Utah amazing things happening already across the state. And I want to highlight one specifically, and I'll explain why. Because last year I did run a piece of legislation that was trying to create a tax mechanism for cities and municipalities, mostly counties actually, so they can use the way we use the SAP tax, in for example, in the state for arts and culture and so forth, that we can have a specific tax component where the public can know where their taxes were going, addressing homelessness and addressing other pieces related to social determinants of health as an investment mechanism. And of course, I struggle. It's a new concept, and I got a little bit of a pushback, but that concept came after working with people in Weber County. And I know the director for one of those programs is actually is participating of this presentation, of the conference this morning. But I've had a chance to work with her, and she's actually my co-chair in the Women in the Economy Commission, Melissa Melissa is working, the work she's doing, and it's related directly to she's executive director and CEO for the Center of Excellence and Integrated IGP approach. And the Center for Excellence is really looking into generational poverty in an integrated way and addressing all of these components through very hands-on coaching and direct, not only direct services to those families, but bringing the entire family together, children's stability, but addressing food security, employment, housing. It has to all come together, and they're doing their return on investment, the way they're using those metrics to find it's really refreshing, and I think it speaks really well with some of my colleagues at the legislature. So keep an eye on what Weber County is doing, and the Center of Excellence in that area. I really kudos to her for that work. And I'm excited because she also now is integrating some of that stuff into the Women in the Economy Commission. Like I said, we both co-chair that commission, which is a governor's commission. So with that, I just want to, I guess as I wrap here, is one, there are opportunities. There will be good pieces of legislation. So I hope to get the support from some of you. I saw some of the comments of what bills we should support. So keep an eye on my coverage for all kids bill and the food security task force, which will create that blueprint and the plan for the state, but also other pieces related to funding. I mean, sometimes we miss the fiscal piece because they're not in a bill. They come as appropriations requests. And I want to make sure people understand how critical those are. And they will be also right now, especially with those $400 million that, we were not expecting. And part of it is the influx of the federal, the federal assistance that we got. I mean, through the CARES Act and so forth. It created, it was able to bring to our economy more money, and that's great. But we're treating them as a one-time issue because we know it may not, we don't know for how long that's going to be there. So those funds should be, I think, utilized for housing as a priority. So with that, thank you again for the opportunity to speak. It's always a pleasure to be surrounded by amazing innovators on this area, and looking forward to hearing from all of you during the legislative session. Thank you, Bill.
Hey, thank you so much for joining us. And thanks for mentioning that Melissa is on this call. There are actually 50 people, over 50 people who are logged in right now. There were 70 people who enrolled, including people from Salt Lake County and Weber County government, people from housing authorities in different parts of the state, people, actually county council member, Salt Lake County council member, Amy Winder Newton registered. There were a couple of your colleagues in the legislature who said they were going. So, I mean, there are a lot of people who are very interested in this, and we're grateful for your insight into how we can move forward. And actually, both of your bills sound amazing. So thank you for talking about them. There's one other issue related to child homelessness that I just wanted to talk about briefly, because I think Senator Kitchen mentioned that we were disappointed that the governor did not include increased funding for housing in his budget, but he did have $100 million job upskilling initiative. And that could potentially help low-income families at risk of homelessness or coming out of homelessness to increase their income so that they can afford our elevated housing prices without assistance. One thing that I noticed is in the discussion is that they don't talk about integrating adult education into those efforts. And I think when you're looking at families, the parents and homeless families, there's a large share who don't have a GED or high school equivalent. And so I think it's important that adult education is integrated into that. We would love to, we will, in terms of, so this meeting was hosted by Crossroads Urban Center and the Coalition of Religious Communities. We are going to be following up with this by having a weekly 30-minute check-in on Wednesdays at 1 p.m. Our first one will be next week on Wednesday. It's our hosts are going to be Pastor Bridget Wyer from Our Savior's Lutheran and Pastor Christina Igueria Street. I just said her name wrong, and from St. Matthew's Lutheran Church. Representative Ray Ward has agreed to join us on that call, and which is great because he's on committees that have jurisdiction over the issues we've talked about. And so if you're are not on the our weekly email update on issues of hunger and homelessness, you can sign up for it on our website, crossroadsurbancenter.org, or you can reach out to me personally. I was expecting this to be good. It was better than I had hoped it would be. So thank you so much to our amazing panelists. I really do think, I mean, the thing about child homelessness is that it seems, you know, when you talk about the total number of families that become homeless in a year, it seems like a big, huge problem, but it also seems like a problem that is small enough that we really could take big strides in addressing it. I think if we take big steps toward investing in affordable housing, will help people for whom families for whom homelessness is about a short-term crisis. I think if we figure out ways to provide better services to families that become homeless multiple times, we can help them move forward and without future incidences of homelessness. There have been people asking questions and getting answers in the chat function. I actually would like, I think if you have other questions, send them to me via email, bill@crossroadsurbancenter.org. Actually, I think it's a good time to end. So I'm going to thank everybody who participated, and I hope to see all of you sometime soon. I will find a way to make sure that everybody gets a copy of the PowerPoint presentation. Thank you so much.